My name is Taylor Torres, and today we're going to go ahead and do a couple of muscular endurance assessments. We have our client here, Eddie, and so the first assessment that we're going to go ahead and do is our ACSM push-up assessment. So with this assessment, we do not need any equipment. All you need is your client and at least a level surface or floor to be able to perform our push-ups on. So the purpose for this assessment is to determine how many push-ups that our client can do, which will allow us to see their baseline level of their muscular endurance ability. And so, like I said, so the setup is very simple. You can also have a mat just in case for a little bit more comfortability for our client. But in our case, all we're going to use is just the floor, and we're going to have our client here. So the first thing that we're going to go ahead and talk about is our beginning and starting phase. And so our starting phase, we're going to go ahead and have our client get onto the ground on his hands and his toes. We are going to have our client fully extended out. We want to have his arms directly underneath his shoulders and a little bit wider than shoulder width apart. And we want to make sure that his head is up and not down. So that's going to be our starting phase. So that's going to look like just like this. As I stated, my hands are underneath my shoulders. My arms a little bit wider than shoulder width apart. My ankles are flexed and my back is level and straight. So that's going to be our starting phase. Okay, so the next phase that we're going to talk about is our execution phase. So our execution phase is when I'm going to go ahead and have our client go down into that push-up position. He's going to go ahead and make sure that his back is level, his chin is going to touch the ground, and then that's going to be our execution phase. And then continuing that phase, he's going to go ahead and raise his entire body by extending his arms and his elbows out to be able to get back into that original starting position. So what that will look like, I'll give you a demonstration. That will look just like this. So that's what we're going to be doing for this assessment. So the only thing that I do want you to consider is to make sure that you are going in a consistent pace. If you do stop at any time, that's going to go ahead and cause us to stop our assessment, and I'll just record how many you've done so far. A few other things that we want to discuss are the common faults and mistrials that occur with this assessment. So sometimes our clients will go ahead and have our bodies not level, and so that'll cause a mistrial, and we'll have to discuss that with our client to make sure that we have better form. Also, the client will either have a drooping hips or their hips will go up in the air. And so those are just common faults that will happen, as well as having our chin facing down. We want to make sure that our chin and our head is up so that we can get a better, a proper form and a better assessment. So I'm going to go ahead and have you practice. We're just going to go ahead and do one push-up. So I would like you to go ahead and get into your push-up position, and you're going to go at your own pace and just do one push-up. Good. You can go ahead and stand. So what I did notice with his form, he had great form. He made sure that his head was up and looking forward. His chin went all the way down to the ground. His stomach did not make contact with the ground, which was great. He had his hands a little bit wider than shoulder width apart. And he also made sure that his body was level and straight the entire time, going down into that execution phase and coming back up into that starting position. So now we're going to go ahead and get into the assessment. I'm going to have you do as many push-ups as you can, making sure that it is at a constant pace and a constant rate. When you do stop, that's going to be the end of our assessment, and I'll just go ahead and record that. Okay? Good job. So our client did 10 push-ups for this assessment, so I'm going to go ahead and record that. And so with this data, I can go ahead and use it for to be able to prescribe any other type of muscular endurance exercise for our client. So the next assessment that we're going to go ahead and do is our ACSM curl-up assessment. Hi, so we are going to continue with our ACSM curl-up assessment. So for this assessment, all you need is just your client and a level and flat surface and 2 pieces of masking tape or any type of tape that you have. You can as well have a mat just to bring a little bit more comfortability to your client. At this point, we do not have access to that, so all we're going to use is our floor, and then like I said, we have our client and our 2 pieces of tape. So for the setup for this assessment, the 2 pieces of tape that you will need, you're going to go ahead and place them 2 distances away. The distances will be determined based off of our client's age. So if our client is under 45, the distance of the tape will be at 12 centimeters. If our client is over 45, it will be 8 centimeters. So because our client here is over 45, we're going to have our 2 pieces of tape at a distance of 8 centimeters apart. So the next thing that we're going to go ahead and talk about are our starting phase and our execution phase. So our starting phase with this assessment is that we're going to go ahead and have our client lie onto the ground on his back in a supine position, making sure that his feet are flat onto the ground, his legs and his knees are at a 90 degree, his hands are flat on the ground, and his palms are touching the ground. So that's going to be our starting phase. So I'm going to go ahead and demonstrate that to you. You can go ahead and stand on the side. So this is going to be our starting phase. We also want to make sure that our fingertips are touching the very top of the tape. This is going to be our starting phase. So our next phase is going to be our execution phase. So from our starting phase, we're going to go ahead and flex our spine about 30 degrees to be able to curl up forward to pass this second piece of tape, like I said, which is 8 centimeters away, or at 8 centimeters apart from that first piece of tape. So the way that we're going to do this is a metronome will be playing, and a metronome is basically a rhythmic beat. And so our client is going to go ahead and curl up and down to our metronome. Our metronome is going to be at 40 beats per second. And so we're going to start at our starting phase. When our client hears that first beep of the metronome, they're going to go ahead and curl forward, sliding their fingers on the ground to pass that second piece of tape, which is 8 centimeters away. And then once they hear that third beep, they're going to go ahead and drop back down into their starting position. And it's going to continue on until the client can do as many as they can, or if the client reaches 45 curl-ups, or the assessment will stop if our client is unable to perform the assessment properly. So a few common faults and a few things that will cause the assessment to stop is if, like I said, our client reaches 75 curl-ups, or if our client's hands are not sliding on the ground to reach that second piece of tape, or if one of our arms is reaching the tape and the other is not, as well as having our client's feet lift off of the ground. So those are just a few things that will cause our assessment to stop. So I would like you to keep that in mind. Now I will give you a warning if that does happen, but you will be allowed to continue. If I tell you a second time that it's continuing, we're going to have to stop your your assessment at that point. So just make sure that, like I said, we're keeping our feet down on the ground. We're sliding our hands forward from the first piece of tape to that second piece of tape, and we're doing as many as we can. So I'm going to go ahead and give you a full demonstration of our starting phase and execution phase, and then we're going to go ahead and have you do a practice trial, and then we'll get right into the assessment. So from this point, we would hear the metronome start, and I would go up with the beat, cross my fingers across the second piece of tape, and then curl back down. And then come back up, curl back down, up, and then curl back down. that's what it will look like. So I'm going to go ahead and have you do a trial. I'm going to start the metronome for you so you can get a actual trial and see what it's going to be like. So I'm going to go ahead and have you lie down and get into your starting curl up position. Go ahead and scoot back a little bit from right there. Okay, and I'm going to go ahead and start our metronome. Okay, and go ahead and start. Okay. Good. Okay. So that was just our trial. So what I did notice so far is that our client a little was missing the tape with one of his arms, so I would go ahead and warn him and just let him know that that's something that he needs to try and fix before we continue. But overall, he had very good form. He had his feet nicely onto the ground. His hands were sliding forward and he was curling up and curling back down to the pace of the metronome. Okay, do you have any other questions? Okay, you're gonna go ahead and get started when you hear that first metronome, when you hear that first beat. Good job. Good job. Thank you. You can go ahead and stand. So what I recorded right now was 15 curl-ups that our client was able to do. So as I stated with our push-up assessment, we can also use this assessment and data to be able to determine which type of exercises and just his baseline level of what we know he can do to prescribe other exercises for his entire workout regimen. So the next assessments that we're going to go ahead and do, not assessments, the next two things that we're going to go ahead and do is take his blood pressure and his heart rate. Hi, so we are going to go ahead and continue with our client here. We're going to go ahead and take his blood pressure. So before we get started, I'm going to go ahead and use our client's left arm to take his blood pressure. I have my blood pressure cuff here, and I also have my stethoscope. So the first thing that I'm going to go ahead and do is place our cuff onto our client's left arm right above his brachial artery. And then once I do that, I'm going to go ahead and inflate his cuff to 180 millimeters of mercury. And then once I do that, I'm going to go ahead and place the head of my stethoscope onto his brachial artery. And then I'm going to go ahead and deflate the blood pressure cuff at 2 millimeters of mercury per second. And then I'm going to go ahead and listen for the different beats. That's going to be how I will be able to find his blood pressure. So as I stated, I'm going to go ahead and place the cuff around our client. So I'm going to go ahead and have him lift his left arm up and go ahead and rotate that. Actually, first I'm going to find his brachial artery. Now I'm going to go ahead and place the cuff a little bit above that artery. Now when placing the cuff, we want to make sure that the cuff is not too tight and it's not too loose. And to do that, I'm going to go ahead and place my 2 fingers in between the cuff and his arm. Okay, perfect. And so the next thing I'm going to do, I'm going to go ahead and put this onto our cuff. I'm going to go ahead and find his brachial artery. And the next thing I'm gonna do is I'm gonna go ahead and inflate, I'm gonna go ahead and place the head of my stethoscope onto his brachial artery. And then now I'm gonna go ahead and inflate the cuff to 180 millimeters of mercury. Now I'm going to go ahead and deflate it at 2 millimeters of mercury per second. Okay, and so what I heard right there was 143 over 75. So I'm going to go ahead and document that, and that's going to be for our client's blood pressure. So the next thing we're going to go ahead and do is take his heart rate. Hi, so we're back here with our client Eddie. I'm going to go ahead and take his heart rate. So the first thing I'm going to do is I'm going to go ahead and find his radial artery, and then once I find his radial artery, I'm going to go ahead and measure that for 30 seconds. I'm going to count how many beats that I feel, and then I'm going to go ahead and multiply that by 2, and that will give me his heart rate for 1 full minute. So I'm going to go ahead and find his radial artery, which is here, and I'm going to go ahead and start. So what I just recorded was 38 beats per second. So as I said, I'm going to go ahead and document that. And then I'm going to go ahead and multiply that by 2. And I just got 76 beats per minute. And so that's his heart rate. And so that is an overall view of all of our assessments for our muscular endurance. And I want to thank our client here, Eddie, for his participation in all of our assessments. And thank you.